check my estrogen, et cetera, et cetera.
And is that where you start first with the blood? Is that, do you typically do that, or is it?
I mean, it depends. Yeah. I mean, some of the blood work is probably, in my view, is probably overdone by doctors and probably unnecessary. But if it makes the patient feel like, okay, we're doing something that's good, in Kelly's case, checking her hormones is really important because she is going through that kind of transitional time where things get weird, funky from a hormonal perspective. And we need that objective data.
Why do you think that your hair is falling out? You think it's from premenopause?
I do. Yeah. That stress. I had 2 major bouts of sickness, COVID, the flu, sickest I've ever been.
She had the flu 2 months ago, so sick.
I think these viruses are ramping up, it feels like. I mean, I don't know, maybe it's just age, but
I thought that was just us. When the kids going to school, I was like, I think they bring home the plague. I thought
Don't even say that though, because we haven't gotten sick in a while. Don't even say that.
But for a couple months ago, I was like, I'm done. Just phone it in. Shut it all down.
Wait, I have a question that I feel this is the perfect question for both of you.
Mm-hmm.
When you come to him and say, I'm losing hair, I feel like I'm getting premenopausal, do you put her on hormones? Like, does that mean it's time for a hormone intervention?
Not yet, he didn't say.
Well, we're about to. I mean, she's about to start progesterone, which is common because for women, just elemental level, the first hormone to decline for females is progesterone. Most women won't be able to keep up with progesterone demands starting in their 30s, certainly in their 40s. Kelly's going to be, 44? Yeah.
Yeah, in a couple weeks.
Yeah. And so that's common for women to have a lower progesterone output during the month. And that progesterone is so important to balance estrogen. If you get estrogen dominant, it can lead to a whole host of things. Progesterone, we're talking about bioidentical progesterone, very safe, works very well.
Talk to us about TRT. Give us
testosterone?
Yeah.
I don't want it. It breaks me out.
Yeah, it's challenging for women. I mean, men love it, and it's great for women too. I mean, it's a biosocial hormone, so it's unique. It's like the locker room effect. So the more testosterone you're around, actually, you can raise your testosterone, which is interesting. But I think of testosterone really being beneficial for the nervous system first. So typically, a man will come in, men start to lose testosterone in their 30s, 40s, same as like women progesterone, and they start to get depressed, cranky, don't sleep as well, not confident. Obviously, physical things, they don't recover as easily, harder to keep lean muscle mass, they can gain weight, decrease in libido. I mean, these are all very real things. And, for a long time, men were told this is just aging, suck it up. And testosterone is a very powerful hormone. And
Does it make you grow a small penis clit? Because my friend went on it and maybe she took too much and she told me that her clit grew. Is this true?
I think anything's possible, Lauren. I guess it's true for your friend. That's what I'm going to say.
I just wanted to know if it's something that happens regularly.
I don't hear this from people, so.
Maybe they're taking too much.
Yeah, I mean, I think anything's possible. There's going to be feedback loops.
Okay.
Right? And so there's feedback loops from the brain to the genitals that, it could work both ways.
But I want to actually stay on this topic for a while. My friend, actually, we're at dinner last night and my friend goes, actually, I'm not going to say put the gym on blast, but if you're in Austin, it's like one of the more fit community. People know the gym we're talking about.
Okay.
And he was saying that like a lot of the guys in there are like raving about TRT and love it. And what I told him, and I did a post the other day and I got some people writing questions like, are you on TRT? And I said, not yet. I'm sure that I will be.
Sure.
One day at some point.
Yeah.
My perspective is that I'm holding off now until I feel some of the symptoms that you're talking about, until we do our blood work and get into that. But
you are cranky sometimes.
Yeah. Well, I'm cranky sometimes. Maybe I'll do some TRT then. But what I was saying is like, I think that and we've talked about that, is there's a real place and time for it, but that also people could maybe abuse it or start too early when not necessary. And I want you to talk about that both for men and women. Because what I told this guy is he's young and I was like, I don't think you need to do that. There's other things you can do before that.
Yeah. I remember I had a patient, he was like, I don't know, mid-20s. This was many years ago. College athlete. And he got started probably at the age 17 or 18, taking testosterone and taking growth hormone. Right. And so he felt like Superman. And so for years, he could wake up to a really intense workout, get gains, not feel sore, and do it every day. And it was awesome. And it was great for him. And then he got involved in a relationship and he wanted to have a child. It's very challenging to maintain healthy sperm production when you're on exogenous testosterone, because the testosterone you're taking will shut down the signaling from your brain